going. Okay. Hello everyone. Right. Okay. It's Tuesday, the 11th of March. Okay. So, I'm gonna just give you an update. I'm gonna keep it a lot shorter this time, so you don't have to be bored. Okay. Got a little bit of a list to run through. Okay. Right. I'm sound. Currently, feel pretty much the same. Just same as like a week ago or just after surgery. I'm mobile and all the rest of it. So yeah, all good on that sense. A little bit balance is sort of a little bit out, but nothing major. Get a little bit tired in the day and that, but that's cool. Scars, healing all right. Pretty chuffed with it. Hair's growing back a bit. So yeah, give it another 2 weeks or something, and then see the state of that. But like I say, it's not the biggest thing in the world. I've gone fat, as you can probably tell. Fat, look at that bump there. See that? Yeah, so I've gone really chubby.
Mostly in the cheeks.
Do you know what? Go away.
Sorry.
Yeah, I'm like a hamster. It's like I'm storing food. So I've gone really fat. I've put on, hang on, what was it?
A stone and 4 pounds.
A stone and 4 pounds in like about 2 weeks. So this is like the biggest I've ever been. Having said that, like I said, I had a meeting yesterday, and the steroids I'm on have been massively reduced, like quick time as well, after seeing this doctor. So that'll sort itself out from over the next sort of week or so. Oh yeah, and my skin, yeah, it's got loads of like outbreaks and stuff, especially on my forehead and that. So Holly, go away. Go away. She's coming here, she's eating, crunching away. Flipping heck. So anyway, so yeah, steroids have been massively reduced. So hopefully that will just sort of bring me back to normal in terms of the way I feel. But like I say, moods are sort of up and down because of that as well, and sort of sweating in the night. It's a few little bits, but it's all bearable. It's nothing massive, right? So anyway, right, okay. More importantly, okay, went to Birmingham Queen Elizabeth Hospital yesterday, cancer centre, and saw a chap called Dr. Spooner, who, as I previously mentioned, is more of a specialist in this PNET type tumour. Having said that, it's still obviously a rare one. You know, there's not like tons of cases on this. The verdict on it, unfortunately, and I'm not going to sort of sugarcoat this in any way, but unfortunately, the verdict is awful. What he said was, this is like proper serious, really bad. A PNET. Let me get this one. Hang on. He said this is a high grade malignant tumour. Which, yeah, it's well, put it this way, he made it a lot more serious than what I've been told from Walsgrave anyway, and like I say, he knows his stuff, man. He knows his stuff. So anyway, so what it means is, I was previously told that I was going to have chemotherapy in tablet form and radiotherapy probably once a day for 6.5 weeks. That's changed now slightly because the chemotherapy, and again, this is to be confirmed still. I've got another meeting next week with him because they're still trying to work out the course of treatment here, in terms of like which type of chemo that they want to put me on. The chemotherapy, let's start with the chemo. The chemotherapy will be a 12 to 14 week course, 3 or 4 days a week at Birmingham. So whereas I was told before it's going to be tablet form, it's going to be that. It's also probably not going to be in tablet form. It will be in injections and maybe a drip. But again, like I say, it could be anything. What he said about chemo was, well, and the radio, which I'll come on to, he said it is going to hit you hard, really hard. Like you're going to be pretty ill. So that's that. So that's chemo. And what he also said is it will go chemotherapy, and once I finish that, it will then be radiotherapy. It won't be both at the same time, like I was told as well. So the chemo is going to hit me like a ton of bricks. Sickness, hair loss. What else did he say, Holly? What did he say the chemo is going to do to me? Tiredness, sickness, hair loss. Just generally just feeling rank, basically. Yeah, low immune system. Is that the skin one as well?
Skin will be radiation.
Not chemo, no. Right, okay, sound. So yeah, so I've got to go into Birmingham a lot for, like I say, 12 to 14 weeks to go and have chemo. So yeah, that's that. Like I say, they don't know. He still doesn't know what type of. I mean, that's the first time I met him yesterday. He wanted to speak to me about stuff. So he's still working out the thingy. One thing, I mean, like for example, one thing I've learned really that has changed my sort of perspective on things is I kind of had it in my head that. Sorry, the time's running away with me here, but anyway, I had it in my head that because I'm 28, that makes me a better off than someone that's say 58, 68, 78, whatever. He sort of told me, what he told me is because of this type of tumour, it would be better in a 15-year-old than it would be a 28-year-old. Which, I mean, I was sort of thinking, well, how could that be? Surely a 15-year-old wouldn't be as strong or physically or whatever. But it's almost like the younger the better for recovery. So that sort of changed. It sort of changed my mind on that a little bit. But so yeah, so almost like the fact that I've got this old at 28 is like worse than being young or whatever. So anyway, so he also mentioned something like, well, actually Holly brought it up in the meeting called, there's a treatment that's just come out of Italy, a chemotherapy treatment called the Milan treatment. Milan protocol.
It's been used in that exact tumour for children, and
right,
it's
okay.
had some success.
Okay, so the Milan protocol, which has been used to treat this exact tumour in some children, and he says, well, I have used this, but he said he nearly killed 2 teenagers by using it.
So strong.
Because it was so volatile.
He said we didn't repeat.
He says we didn't repeat it. What he said was, if I were to put you on that course of treatment, it would probably kill you. So he said the results and the whatever. He says, for me, he says I didn't see anything significant. That's just a new type of chemo, but obviously that's
They learn new stuff all the
that
time.
yeah, they're learning new stuff all the time. So anyway, so yeah, so chemotherapy is going to make me feel awful. 12 to 14 weeks. I don't know when it's going to start yet. It's the what, coming up the middle of March. I might not start for 2 weeks. I might not start for 6 weeks. I don't know. One thing that he reiterated was it's not the delay isn't significant. It's not. It shouldn't cause any adverse effects or whatever. Even though this what's in there now still wants to spread about, go down, wants to go down the spine and all that. But yeah, this is like.
He said getting the concoction rates back.
Yeah, he says getting the concoction right of the treatment is more important than anything else. So yeah, so obviously the wrong type of treatment could see me off or whatever anyway. So that's that. Right, then we go on to radiotherapy, which shouldn't be quite as bad in terms of the physical element of it, I think. But whereas it's usually the radiotherapy apparently doesn't last very long. The actual treatment itself only goes on for like 10 minutes or whatever. And then the rest of the time is all the setup stuff and that kind of thing. But anyway, so that was set to be every day for 6.5 weeks. He, again, subject to change, but he mentioned yesterday he would prefer to do it twice a day with a 6-hour gap between each one. So what that's going to mean is, obviously, I don't know, for example, going in, having one at around, I don't know, well, it could be any times, but 10 o'clock and then 4 o'clock or something like that, which logistically, obviously, brings up its own problems as well. But like I say, it's not the biggest deal in terms of the travel and stuff. It's just time wise. I mean, looking at that, worst based on what he said here, not worst case, but based on what he said here, we're looking at about 5 months, almost daily, of treatment. So that's a trek. That's a lot of treatment to have to go through, and then yeah, so a lot of stress, a lot of pressure, just on that, and obviously I'm gonna feel pretty rank as well. So yeah, not good news. If I'll give you the unfortunately it gets worse than that, I'm afraid. So bear with me. When I was at Walsgrave, they told me that my sort of survival chances were 60 to 80% for 5 years. Now, this professor, like I say, he doesn't know as much as this other guy about this, and this chap, Dr. Spooner, was as straight as it come. He said, and it was him that brought it up, I didn't even mention it, he says probably 50-50. He says it's a coin toss. Depends how much, I don't know, it depends how much you can take. He said this is I might have said this already, but this is a really, highly aggressive type of cancer. So 50, he reckons 50-50 for a 5 year.
He did say maybe more.
He did say maybe more, but we're not talking like 80. He said not 80. So 50-50 is not good, really bad, but but they're still, like I say, they're still trying to knock it out of me. They're still, it's not like there are types of radiotherapy that are there just to make you pain free or whatever. So they're not doing that. It's still in their minds to yeah to get me better. That hasn't changed. So yeah, really sorry to give you that bit of news, but that's how it is. I'm alright. I'm sound. Like I say, I've got a few weeks now, maybe before treatment starts and whatever. So I'm happy enough.
Tell them the radical things you want to start doing.
No, because I haven't thought of any. So yeah, just I might go away again. Went to Disneyland like last week with Holly and Brooke. That was quality. Loved it. So I don't know, if I get a bit of time, I might go away again for a few days or a week or whatever. And just because I might not be in a state to do it after or what have you. So yeah, just enjoying it, to be honest, and treating myself to some nice things. And I bought a wallet the other day. I bought a new wallet. So how radical. So yeah. So that's about it for now. Anything? Can I not leave it more positive than that? I've got a 50% chance.
It's got a 50% chance.
No, go
Sorry.
go away. You get out.
Sorry.
I've got 50%. They could have said 10%. That's
Yeah.
more positive, isn't it?
It is positive.
And if it
said no chance.
if they'd said 10%, they could have said 5%. So that would have been even more positive than 5%.
That's right. You're good at maths. Another positive.
Oh look, I've gone on for ages again. Right, I'm going to stop now. Okay. So yeah, cool. Got another meeting next week. Same guy. Hopefully, I'll get a bit more detail and in terms of the treatment, and like I say, hopefully my next video will be a little bit slimmer as well. Look at that.
If not, there's that. That's turned up this morning.
Yeah, cool. I haven't ordered that. That's just dropped through the door, by the way.
Right, come on, let's finish the video. I don't want to see your spots, and you're just using this as a way to look at yourself.
Right, see you everyone. I'm good. We're good.
Bye.
All right.